Hello and welcome to Eco-Terrorism. I'm Zeinab Bailoun. Malnutrition is an affliction affecting countless people around the globe every day. Here with us today to discuss acute malnutrition and its consequences is Ms. Farah Asfahani, a field coordinator at International Orthodox Christian Charities. Thanks for joining us today.
Thank you.
So before we start our discussion for today with Ms. Asfahani, take a look at this first report that we have.
Acute malnutrition is a devastating public health problem of epidemic proportions. Worldwide, some 55 million children under the age of 5 suffer from acute malnutrition, and 19 million of them are from the most serious type, severe acute malnutrition. Not to mention that every year, 3.5 million children die of malnutrition-related causes. The human body needs energy and nutrients to function. If food intake is inadequate, the body begins to break down body fat and muscle. Metabolism begins to slow down, thermal regulation becomes disrupted, the immune system weakened, and kidney function impaired. Decreased food consumption, increased energy expenditure, and illness result in a poor nutritional state, known as malnutrition. Such malnutrition is associated with increased illness and death, reduced educational achievements, reduced productivity and economic capacity, and is one of the principal mechanisms behind the transmission of poverty and inequality from one generation to the other. Acute malnutrition is usually caused by a decrease in food consumption and/or illness resulting in a sudden weight loss. The Syrian people, whose crisis represents one of the most devastating catastrophes among mankind, face malnutrition in some of the refugee camps. A report released in January 2013 stated that among the refugees in host communities, 75.5% of the families consume canned food, and more than 90% of families consume this canned food in the Zaatari camp. Moreover, more than 50% of Syrian families in Jordan consume canned food 2 to 3 days per week, and in the Zaatari camp, 21% of families consume canned food almost every day. How dangerous would be the effect of such condition on the lives of those refugees? What are the possible improvements to save their lives from this slow death?
So, Ms. Asfahani, we saw a few images that are perhaps difficult to process and to consider. What can you tell us about malnutrition and what exactly are the different types?
The word malnutrition itself literally means bad nutrition. When you say bad nutrition, it could mean overweight, underweight, a deficiency of a certain vitamin or mineral like iron deficiency or others. But here the word malnutrition will mean undernutrition. In undernutrition, we have several types. We have chronic malnutrition and acute malnutrition. Chronic malnutrition is when there's growth failure over time. So when a child over time is not eating well, he will get chronic malnutrition, which presents itself in form of stunting. You see a child who is proportionally, he looks normal, but he is shorter than other kids his age. This is chronic malnutrition. Acute malnutrition is when there's a weight loss, a very fast weight loss in a very short period of time. This leads to acute malnutrition, which presents itself in wasting. You see a child who is very thin, like the images we saw. There are 3 clinical forms of acute malnutrition. We have marasmus, which is you see a child who is wasted, who is very, very, very thin. There is kwashiorkor. In kwashiorkor, you see a child who is bloated, like the children we saw in the report. They have water retention or bilateral edema. And the 3rd form is marasmic kwashiorkor. So when you have both of the signs in one child. In acute malnutrition, there are also 2 types based on severity. There is moderate acute malnutrition, which is commonly called MAM, and there is severe acute malnutrition, which is commonly called SAM.
Are there certain types of malnutrition, of the ones that you mentioned, that are more dangerous than the other types?
Of course. Both are detrimental, have detrimental effects regarding intellectual growth and growth in general. But acute malnutrition seems to be more dangerous because it increases infantile mortality. A child who has acute malnutrition is at risk of death if not treated. A child who has chronic malnutrition is not at a very high risk of death because the body has some sort of adaptation system to this chronic lack of adequate food.
So they're more at risk of developmental being stunted, basically developmentally, as opposed to dying.
Exactly.
The second greater risk. What are the other consequences that malnutrition has on the human body?
One very dangerous consequence of acute malnutrition is reduced immunity, as was mentioned in the report. The body is less immune to infections in particular. So the likelihood of getting an infection is increased. The duration of the disease is increased, and the severity of any infection that you catch will be increased. This will cause a child to have reduced appetite. You know, when you have an infection, you have reduced appetite. This reduced appetite will cause the child to lose even more weight, and the malnutrition will be aggravated, and the child enters a cycle of malnutrition causing infection and infection causing malnutrition.
What are the main causes behind malnutrition? Where does it come from?
There are many causes of malnutrition. We tend to think that food is the only cause behind the acute malnutrition. UNICEF actually created a conceptual framework classifying causes of malnutrition into 3 categories. There are basic causes, underlying causes, and immediate causes. Basic causes mainly deal with the context itself of the country and of the society. So we're talking social context, political, and economic context. These basic causes have also underlying causes which are related to the household and the community. We can identify 3 main underlying causes to acute malnutrition. One being the environmental situation in which the family is living. So we're talking hygiene situation, we're talking access to health services. Another underlying cause is childcare. When we're talking childcare, we mean breastfeeding, complementary feeding, infant and young child feeding practices in general, and how the mother is caring for her child. A third underlying cause of acute malnutrition would be household food insecurity. So having or not having access to safe food in a sustainable way. Immediate causes are at the individual level. They would be either disease or inadequate food intake.
So you also mentioned a little bit the ideas of politics, economics, different parts of society are also affected by this phenomenon of malnutrition. So how does malnutrition affect society as a whole, as opposed to its effects just on the human body?
We think that acute malnutrition would only affect the public health sector. In fact, it affects education and the economy very, very much. In terms of education, a child who is malnourished is logically very tired and not able to concentrate to learn. In fact, many studies have studied the effect of both acute and chronic malnutrition on education and have found that learning abilities are reduced when a child has either chronic or acute malnutrition. Economically speaking, the health costs of treating malnutrition are high, which affects the economy negatively. But also malnutrition has an indirect effect, negative effect on the economy, because a child who is malnourished has a less chance to be able to generate income like any other person in the future.
So if we talk about different regions of the world, which regions are the most commonly affected by malnutrition?
Mainly it's Africa and Asia. In terms of the Middle East, we are not very used to see forms of acute malnutrition. However, the Yemen is a country which has one of the highest rates of malnutrition in the world, not only in the region. Due to many causes like the ones we mentioned earlier, like poverty, like access to food, like not being able to exclusively breastfeed, and also gender inequality, which is an issue in the Yemen. It also affects access to food. Nowadays, due to the Syrian crisis, we are seeing cases of acute malnutrition in Syrian children as well.
We'll come back to talk more about Syria right after the break, so please stay tuned.
Women's rights redefined.
So, Ms. Asfahani, before the break, you were telling us about malnutrition in Yemen and about its effects on different people over there. What about Syria? What exactly is going on over there, and why is the situation different?
The report mentioned the results of an assessment. It was a UNICEF-led assessment and done by the International Orthodox Christian Charities, IOCC. It was done in the end of year 2013 to study the nutritional situation of Syrian refugees in Lebanon. The results of this assessment showed that there's a global acute malnutrition rate of 5.9% among Syrian refugees in Lebanon. Global being both moderate acute malnutrition and severe acute malnutrition. We have around 2,000 children, Syrian children under 5, who have severe acute malnutrition, so who are at risk of death if not treated, and around 8,000 children under 5 with moderate acute malnutrition here in Lebanon among the Syrian refugee community.
So why would you say that these Syrian people are more at risk than other people are of malnutrition?
Usually when people leave their homes and go to inside the country or outside the country, their living conditions are changing. Their access to health services is not as easy as it used to be. Their practices to care for their children are affected because there are other priorities at this time. Their access to food, to safe food and to food in a sustainable way is also affected. All these causes make the Syrian refugees more at risk of acute malnutrition than the Lebanese population.
So as a field coordinator at the IOCC, what exactly can you tell us about the IOCC's work and how does it help the Syrian people in Lebanon?
IOCC has been training healthcare workers in primary healthcare centers in Lebanon with the support of the UNICEF and the Lebanese Ministry of Public Health in order to train everyone to know how to assess and treat acute malnutrition because it's something new to our Lebanese context. We are also focusing on awareness sessions on breastfeeding and complementary feeding and all infant and young child feeding practices because as I said earlier, infant and young child feeding practices, if they are not suitable, they would be a very big cause of acute malnutrition. So this is also a way of treating malnutrition by promoting exclusive breastfeeding and correct complementary feeding, and it's also a sort of prevention.
From your work with these Syrian refugees and with the IOCC in general, how critical would you say the situation is?
The situation is not yet a serious situation. Usually it starts getting to the serious, highly risky situation when the global acute malnutrition rate attains 15%. To date, it's 5.9%, so it is not something to just ignore. We need to work on it. We need to prevent its deterioration in order not to arrive to the 15% global acute malnutrition rate.
Whose responsibility do you think it is to work on this issue, to move forward? Do you think the government should be doing more? Do you think NGOs should be playing a bigger role? Do you think the media perhaps need to spread more awareness?
In such situations, everyone has a role. Governments, I'd say, have a very important role to play in the basic causes of acute malnutrition, because we said the basic causes are the social, economic, political context.
Healthcare.
Exactly. They can, governments can help in providing clean water, safe drinking water. They can help promote breastfeeding because it's an issue and it's a key factor in children under 2 especially. Governments can also help people get access to proper health services.
Do you think the government in Lebanon is doing enough at the moment?
At the moment, there is a system for providing proper healthcare services for everyone, for Syrian refugees mainly, because we're talking in the context of emergencies. There are always gaps, and NGOs are here to fill these gaps, are trying to at least. everyone in their specialty. So sometimes NGOs may be filling the gaps in providing non-food items to families that need them in order to help them be able to get access to food, so save the money to get food. Other NGOs work on awareness sessions, because these awareness sessions, especially regarding breastfeeding and infant and young child feeding practices, as what IOCC does, is very important in this situation.
Mm-hmm. Can you compare the example of Syrian refugees in Lebanon to some other example in terms of malnutrition? Have other countries been facing similar problems, or is this a very unique one?
No, other countries affected by emergencies, whether nature-made emergencies or man-made emergencies, you can find acute malnutrition. And where you find acute malnutrition, there are many things in common with our situation in terms of how to assess malnutrition, in terms of how to treat malnutrition, and how to involve the community in the treatment of malnutrition. We are now executing a program called CMAM, which is Community-Based Management of Acute Malnutrition, which is involving the community in finding cases of malnutrition and treating cases of malnutrition, which is why we are training public primary healthcare centers, not hospitals, on the treatment of acute malnutrition, because primary healthcare centers are closer to people and are easily reached.
Mm-hmm. Thank you very much for joining us today. That's it for today, and thanks to our guests in the studio, Ms. Farah Asfahani, and to you for watching. Stay tuned for a short video that highlights the problem of acute malnutrition in Mauritania. See you next week.
Le taux de pourcentage de la malnutrition était très élevé. Cependant, à lors de notre intervention et l'enquête qui a été faite avant cela, ils étaient à 22%, le taux de la malnutrition au niveau de la Muqata'a de Muqtalaja. Et c'est la raison pour laquelle que cette Muqata'a a été choisie parmi d'autres Muqata'a de la wilaya du Brakna.
كنت نقبض له يرضع ونعدل شوي منه كذا ياكلوا يرضع البزول يقبض شوي نعدل شوي ياكلوا تو اللي أكل من البداية اللي في البزول نعطاه شوي من البن معاها.
Le 4e mois 2012, c'est le premier jour de dépistage de Mohamed et ses collègues au niveau de la localité de Michrou. Après avoir été dépisté, pesé et pris sa taille, il nous a indiqué qu'il est en malnutrition aiguë sévère, plus complications. Immédiatement, j'ai dit à mon infirmier de l'amener au centre de Grenas de Maktal Ahjar, qui cependant est encadré par le MSF. Mohamed a débuté par 5,6 kg. Et actuellement, le mois d'août, Mohamed pesait 7,6 kg. Dieu merci. Il est sorti de la malnutrition aiguë sévère. Actuellement, au moment où je vous parle, il pèse 8,1 kg et il n'est plus malnourri. Et même à l'œil nu, quand on voit l'enfant qui était alors dans un stade de malnutrition, qu'il soit mam ou mas, actuellement quand on le voit à l'œil nu, on saurait vraiment que c'est très bien amélioré. Donc la population, alors les enfants de manière générale de la Moqata'a, ils se sont très bien améliorés.